Today, we're going to review the skeletal system. Okay. We're going to talk about what the skeleton is made of, what tissues are part of its properties, and how to identify some of those tissues since we didn't go over them last week in lecture. Hopefully, we've gone over them in lab already. So my questions to you, I'm going to pause, take a couple minutes, and ask you guys to identify these tissues for me. So which tissues are these? So we're good on these, it sounds like. Awesome. Which one is A? Elastic cartilage. How do we know it's elastic cartilage? You can see the lacuna, chondrocytes, but how do you identify that cartilage from the rest? In the ground substance, which fibers do we see? Elastic fibers. How do we know those are elastic fibers in here? They're thin, they're purple, and they're going in all sorts of different directions. That is elastic cartilage connective tissue. That makes up parts of the skeleton. What about B? Which tissue is B? Skeletal tissue, bone tissue. And it is a connective tissue. Skeletal connective tissue or bone connective tissue, either one. Technically, it might not be clear yet. There's two types of this. We'll get to that in a bit. Which one is C? Fibrocartilage connective tissue. You can see there's some space, which is the lacuna surrounding the cells. If you see the lacuna and it's not bone tissue, it's chondrocytes living in there. There's a different cell living in these lacuna. We'll talk about those here shortly. Osteocytes, exactly. In the fibrocartilage, those are all chondrocytes. How do I know this is fibrocartilage? Because you can see the fibers all running in one direction. What type of fiber is that? Collagen fibers. Visual, you can see it. Parallel fibrocartilage connective tissue. The last one, D. What is the name of that one? Hyaline cartilage connective tissue. How do I know that's cartilage? How do I know it's cartilage? Look at the space, lacuna. Chondrocytes live in there because it's not bone tissue. Bone tissue, you see the tree rings. Easy giveaway. But how do I know that's hyaline? Do you see fibers? No fibers visible. Are there fibers there? Yes. Which fiber is present in hyaline cartilage connective tissue? Collagen, but you can't see it. It looks shiny. It looks smooth. That is what hyaline means. Smooth cartilage connective tissue. So when we look at these, I can ask you a very silly question. Don't be shy. Show me your hyaline cartilage. I mean, elastic cartilage. Ooh, don't show me your hyaline cartilage. Don't break those apart. Where's your elastic cartilage? Ear is a great example. And we talked about what elastic is. When it stretches, you let it go, it returns to its original shape. Your ear is a good example. Your ear is one of the skeletal elements that is made of elastic cartilage. What about hyaline cartilage? What is a great example of things that are made of hyaline cartilage? Do you see them there? Ends of long bones. The ends of the long bones are all made of hyaline cartilage. What else? Do you see the intercostal areas that connects the rib to the sternum? That is all made of hyaline cartilage. The bridge of your nose has hyaline cartilage on it. What about fibrocartilage? Where do you find fibrocartilage in the skeleton? Do you see it in red? In between the vertebra, the intervertebral discs, your meniscus, your pubic symphysis. These are structures that are designed to compress and hold mass, like the knees, the vertebra, the pubic symphysis, when you walk. And pretty much the rest of it is all bone. Bone. I mentioned things like this. Did we not? We didn't finish our last lecture, did we? I just remember that right now. Did we talk about this?
Oh, yes.
We did? Okay, I apologize. I'm getting my classes mixed up. Okay. Connective tissue, I told you, has a rule where it is vascularized and innervated. I told you all connective tissues like that, but that's a lie. Professors, we do that all the time. We say that that is how we classify it. But cartilage takes it an extra step. Cartilage is not vascularized or innervated. Why? Because of the properties of cartilage. Cartilage is a gel-like matrix. Because it's gel-like, it doesn't need blood to go into it. The nutrients, the gases are exchanged in cartilage because it's gel all through diffusion. No blood supply directly needed to cartilage. And that will become a problem for individuals who break cartilage, like breaking a bone. Why? Since it doesn't have blood supply, it doesn't have nerves in it, you might not feel it. You might not feel that this down here is wearing away. There's no nerves in it. All of a sudden, your parents go to the doctors, their meniscus is gone. It's been worn away over years. It is not innervated. So sometimes your patients will not feel it. No pain. If they break it, it takes forever to heal because there's no direct blood flow. That is one of the challenges we will have with how cartilage is set up. So when they do heart operations, doctors will always cut through the bone before they cut through the cartilage. Cartilage takes forever to heal because it is not vascularized. I need you to remember that. It's one of the few connective tissues that breaks the rules. Yes. It does heal, but it doesn't heal right. Right. So you'll see these crazy bulges that just don't look right. There is a chondroblast, just like we don't discuss them in anatomy. I don't know why. We don't give them any love. We do. And we're going to talk about that here in a couple of slides. And cartilage have the same types of cells. Since they don't have the same amount of blood flow to them, they don't work as efficiently. That's the downside to not being vascularized. That's why nose jobs can go terribly, terribly wrong. Right? Right. It is a risk. It is a risk. Okay. You have to go to a very, very good plastic surgeon for that. Okay. Bones will come in technically 5 different shapes. I think I'm only asking you to identify 4 when it comes to lecture quizzes and lecture exams. Okay. You have long bones. Here's a good example of a long bone. That means when this bone grows, it grows in this direction. It grows in its length. This is a femur. A femur is a great example of a long bone. I apologize. Let me zoom out or zoom in. Flat bones, even though like this one can look like a long bone, it is not growing in the direction of its length. It grows in that direction. So it's growing not super tall, but it is growing wide, which classifies this as a flat bone. It's in the direction that this bone grows. So therefore, this one is a flat bone. The sternum is a great example of a flat bone. Your femur is a great example of a long bone, the direction that they grow in. Okay. So this one grows wide, which classifies it as flat. Irregular bones, the way that these grow are some of my favorite. So this one grows like in this direction, really growing this part. And this one's irregular because all of this comes off of one side during development. So it kind of just grows these extra parts in an irregular fashion, hence its name, irregular bone. Vertebrae is a great example. Short bones. A lot of your foot bones are short bones, pretty much all of them. What short means is they don't grow very tall and they don't grow very wide. So they almost end up like little cubes. A good example of this are your cuneiforms. They are short bones. Cuneiforms are your ankle and foot, no, your foot bones. Your ankle bones, like the talus, also count. And then you have what we say, this is the one that I don't include in your reading guide, I think. Can't remember. We have sesamoid bones. And the way that these grow is these grow in a very different position, but what they're really there for is to provide some protection. Patella is the only one that I can, there's another one that'll come to mind, but patella is the only one that I can think of at this point of time. Okay, so these are ideal for providing some form of protection. Yes. 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 So fibrocartilage is going to be the meniscus that is in between the femur and the tibia. And we'll talk about that because it's a joint. We'll talk. There's also hyaline cartilage there. There will be both. But most of your meniscus is fibrocartilage, the vast majority. If I were to say, give me an example where you find fibrocartilage, it'll give you options. One of them will be the meniscus or the intervertebral disc. When we look at long bones, we tend to like to describe long bones. Does anybody know why we like to describe long bones the most? Why in anatomy do we like to describe these the most? Why? Anyone? These are the ones your patients are going to break the most. Makes sense, right? That's why we like to discuss long bones and the anatomy of long bones. Okay. Long bones, we're going to focus. This one is the humerus, by the way. Long bones, the way that they're arranged is very interesting. Before I move on, you must remember that every bone is an organ. Why is every bone an organ? Because it's made of two or more tissues. That's the point of this slide. I need you to be able to tell me what tissues we find in long bones. Here we go. So long bones are hollow. In here, you have a cavity. In the center, you have a cavity. I don't know if you can see that well. What is in the center? What it fills all of this space here? What is it? Bone marrow. Okay. Bone marrow fills up long bones, the center of long bones. And we'll talk about this shortly. So that is just a cavity. It is a space. When we take a small portion of bone, we cut that little cube out. This is what it looks like under a microscope. And I hope you can start seeing at the surface, it looks like the histology of skeletal muscle. Here, you have one osteon. That is an osteon. That is the bone unit. This is like the bone unit. Osteon, we have to understand how that's arranged. We should know this for lab. What is at the center of the osteon? What is that center space called? Excellent. And it's named after some, I apologize, I keep saying this and I'll say it again. If I offend anybody, let's talk about it. It's named after some old white dude. What's the name of that old white dude? Haversian Canal. So you will see both names for this. Haversian is the name of the scientist who described the central canal. By the way, that's why a lot of anatomical names will have multiple names because multiple scientists describe it. Some happen to put their names on it. And it's usually white males. Unfortunately, that's the way it is. Central canals, okay? If you notice, what is running up and down the central canal? Can you guys see that in there? This is one of them that's open. What is running up and down it? Blood vessels. That is why we have central canal. We need blood vessels that supply the bone with blood. In addition, you will find nerves in here. Has anyone broken a bone in this class before? Who's broken a bone? Raise your hand. Did it hurt? Did it hurt? Yeah, it's in the back right there, yeah. You don't remember? What about when it healed? Was it, yeah, right? That's the thing, is bones are innervated. They're vascularized. I want you to remember that. And the blood vessel and nerves run up and down the Haversian canals. Okay. And it will remind you, we're broken. It hurts. We need to heal. It will remind you. Okay. As a reminder, cartilage does not always do that. The only time cartilage structures will start to hurt is when nearby tissue is affected by that cartilage being damaged. All right. All right, blood vessels run up and down the Haversian canal. We have three different types of lamella. Lamella are these layers. So here's one layer of bone. Here's another layer of bone. And here's another layer of bone. So each layer is called a lamella. When they make these circles, they're called concentric lamella. They are layers that are in circles. They will make up an osteon. Do you see how this osteon right here has one layer, two layer, three layers of bone? So the whole unit was made up, the osteon is made up of concentric lamella. We have these lamella that do not form circles in blue. Not circles. It does not surround a central canal. That one in blue is called an interstitial lamella. And then we have our third type of lamella. The third type goes all the way around the outer part of the bone. Can you guys see that up there? No, let's try that again in green. We'll go all the way around the bone. It doesn't surround a central canal. Okay. This one is a circumferential lamella. It goes around the circumference of the bone. So there are 1, 2, 3 types of lamella. I believe I asked that in the reading guide, and some students don't know how to answer that. That's what I'm asking you. There's 3 types of how the bone layers are arranged to make hard bone. One thing that folks don't notice, it's a little hard to see here, these little red things. Let me zoom in on those. These are little spaces that are filled with bone cells. What are bone cells called? Osteocytes, and they are in the layers. Those are osteocytes. Osteo means bone, cytes means cell. And they are inside lacuna. This has a lacuna as well. Cartilage and bone have a very similar arrangement how they hold their cells. They both have lacuna. Bone has osteocyte, cartilage has chondrocytes. Okay. Let me see what slide do I have next because I forgot. Nope, not yet. Okay. This region right here is just called compact bone. Okay. That is the region. This is where it gets really tricky, folks. This is where anatomy can kind of be rough on words. That region is compact bone. If I were to ask you, what is that tissue name? What is its name? This is the region. What is the name of that tissue, folks? You said it earlier. Skeletal or bone, connective tissue. Because those are asking specific things. The tissue is bone connective tissue. That region is compact bone. The whole bone is an organ. What a pain. Correct. And they are the bone units that make compact and spongy bone. You may see a little white layer on the outside. It runs down just the outer, it's like an outer white membrane of bone. That membrane is called peri. Remember, peri means wrapper. Periosteum means it wraps the bone. This is the outer layer of bone. It's called periosteum. And as a heads up, this is made of dense, irregular connective tissue. That's part of the bone. You see how there's one tissue? Here's another one. Bone tissue. That's why bone's an organ. There are many tissues that make the whole bone an organ. You can kind of see this pink layer right here. And it kind of just, that pink layer just kind of does this. And it covers everything over here. That pink layer, it is a layer, is the inside layer of bone. So that one is called endo for inner, osteum for the inner layer of bone. This layer is made of dense, regular connective tissue. Now we have a third tissue that makes bone, a whole bone. Technically, we have 4, 5, because nervous tissue is a tissue and blood is also a tissue. Then you have the blood vessels, another tissue. You can see that bone, a whole bone, is made of many tissues, therefore it's an organ. By the way, that's one of my favorite free response questions. Why is the femur an organ? Give me 5 examples. What do I mean by that? Give me 5 tissues. We're going to keep naming them. Don't you worry. So far, I've only shown you 3. The periosteum, compact bone, and endosteum. If you really count the nerves and the blood vessels, that's your 5. Let's keep going. Cells. The osteocells. There are 4 different types of bone cells. I need you to know what they are and what they do. We already named one of them. What are the ones that make these little red dots? Osteocytes. That is what is shown over here. This one is an osteocyte. This one is going to found inside the bone matrix. The osteocyte, this cell, its job is to maintain the bone around it. So bone is made of a calcium phosphate salt, and osteocytes maintain those salts, maintain the calcium, maintain the phosphate. Their jobs are to maintain the bone matrix. Osteocytes. The next set of cells are found, you don't really see them, but they're going to be found at the edges of bone. This is it right here. This is an osteoblast. And an osteoblast is always going to sit on top of this blue layer. This is hyaline cartilage. Why does it sit on top of hyaline cartilage? So it can make new bone. And guess what? Hyaline cartilage is the precursor to new bone. Osteoblast will use hyaline cartilage and they'll put bone in it. They'll kind of kill the hyaline cartilage, but in the process, they make new bone. So how do I want you to remember? B, blast. These build new bone. This is what you need for your bones to grow. Children have very active osteoblasts. That's what allows them to grow. This one can be found over here. It can be found in the edges. This one right here. This one can be identified by having many nuclei. You see how that one has like a bunch of nucleus inside? This one is an osteoclast. Uh-oh, look at just one letter off. They look different, they're found in different places, and they do different things. This one, I want you to remember, this one cuts away bone. This is challenging to think about. Osteoclasts, they dissolve the bone. They break down your bones. Why on earth would you want cells to break down your bones? Who can tell me? Okay, so for rebuilding, the word we say is for reconstruction. Think about it. When this building was built, there was an old building here. What do we have to do with that old building? Break it down, demolish it before we can build a new building as a form of reconstruction. It's also going to be important for repair. When you have old damaged bone, you need to get rid of that old damaged bone and build it again. Osteoclast. This next one is typically found next to osteoblast. So that's an osteoblast, that's an osteoblast. This one in the center, however, is an osteoprogenitor cell. One way to describe what it does is this is a bone stem cell. What does that mean? That means that cell can become that cell. That cell can become that cell. That osteoprogenitor can make more of itself. It's a stem cell. It does not make those. Something else does. That's why it has multiple nuclei in it. So the osteoprogenitor can become osteocytes and osteoblasts and make copies of themselves. It's a stem cell for bone. Those are your 4 bone cells. They all start with osteo. Oh, shoot. This is how your book shows it. I told myself use this slide, not the other one. My bad. Okay. But look at where they're found. That's what this is showing. Osteocytes are found inside the compact bone. So this one is in here. Osteoblast, osteogenic, osteoprogenic, progenitor cells are found at the outer edge. And osteoclasts are found in high abundance in the inner layer. That is true. This one's probably showing that just a little bit better. Where are they found? Whole bone anatomy. So we're still talking about long bones here. Again, we love our long bones in anatomy. You can see this outer layer right here. It's being pulled back. That is the periosteum. This yellow layer, that is the compact bone. And you can barely see a very thin layer of brown inside. That is the end osteum. Okay. Here, you will see that there's a unique layer of compact bone. Compact bone is found in this line here. This line is very important. This is the epiphyseal line. And what's interesting about this is where bone grows from. So when a doctor takes an x-ray of a 14-year-old, they're going to say this 14-year-old has a lot to grow based on how that epiphyseal line looks like. Or this 14-year-old, that's about as tall as they're going to get because of what that epiphyseal line looks like. So that's an area of bone growth, which we will talk about in a bit. I mention it here because those epiphyseal lines are the borders of these top regions. So there's one here, and there's another one here. So these regions are called the epiphysis. That epiphyseal line is the border between the epiphysis and the bone shaft, the center of the bone. You don't see the epiphysis here, but the epiphyseal line, but the epiphysis is the end. Oh goodness, let me try that again. The epiphysis is the end regions of long bones. And it's on both ends. The bone shaft, which is everything else, that is the diaphysis. This is the shaft. Okay. So when we ask, what is the epiphysis? It is the ends, and the border is the epiphyseal line. All right. I mentioned this cavity earlier. It's time for us to know its name. The medullary. Sometimes it's called the canal. Sometimes it's called the cavity. Just heads up. Medullary canal. The medullary canal is specific to the diaphysis. Only found in the diaphysis. The epiphysis does not have the medullary canal, but what the epiphysis has is it's made up of a lot of spongy bone. So most of it is going to be made of spongy bone. Please, next week, don't be shy. Ask your lab instructors to show you real bone so you can see how spongy it is inside. Sometimes it's surprising. I already forgot where I'm going here. Okay. Hopefully I don't have to come back. All right, so there are the regions of the whole bone. Please recall the three layers. What is the outer layer of the bone called? This white stuff that's getting pulled back. Starts with a P. Periosteum. What is the more solid inner part? What are you going to call that? Compact bone. And the most inner layer here? Endosteum. Inside the medullary canal, you have bone marrow. So the bone marrow fills up all of that space in there. What type of bone marrow? What color is that? Yellow. So the three layers there will contain it. So from the most outside is the periosteum, superficial periosteum. In the very middle, the very most deep is the yellow bone marrow. That is part of the bone, but it is not included in the three layers of the bone. It's periosteum, compact bone, and osteum. Then yellow bone marrow. In the spongy bone, okay, this region, which one did I do? Purple. This is the bone tissue. This is spongy bone tissue. Has multiple names. Cancellous, there's another one. Spongy bone tissue is going to work. You can still see it has an osteum in there. That is made of an it's not osteum, an osteon. Remember, that is a bone unit. Even in spongy bone, you will have osteons. Surrounding that spongy bone, this outer layer right here, is the endosteum. This pink stuff is that pink layer there. So the endosteum will hold on to a very small bit of spongy bone, even in the bone shaft. That is important to recognize. Which marrow? Why is it yellow? What is it made of? What is it? I heard it. Fat, delicious. That's why people put it on their toast. It is made of fat. So what tissue is it made of? There is another tissue that is found in bone. Adipose connective tissue. There's a reason dogs love to chew on bones. It is full of fat. Okay. Why is it full of fat? What is that fat doing for the bone? It does many things. It provides nutrition, nutrients. So if that bone breaks, it's going to be the nutrients that it needs to repair it. It'll store nutrients. It'll store fat when you're fasting for long periods of time. You can start breaking down that fat to increase your blood sugar. What else is it for? Why else would you want your bones to be full of fat? Support. Your bones cannot be solid bone. If your bones were made of solid bones, they would weigh too much for you to move around. Well, guess what? Fat is low density. That means it doesn't weigh very much, but it provides support, internal support for the bone and not have it weigh as much. Okay. So when I ask you, what are the two major functions of yellow bone marrow? There they are. Nutrients and support for bones. What is it made of? Adipose connective tissue. 95% of it is adipose connective tissue. I don't want you to worry about the rest of it. Well, guess what? There's yellow bone marrow. What other type of bone marrow is there? Red bone marrow is found up here. Oh, let me pick a better color. Can't really see that. I'm gonna make it in blue. Apologize, it's not red. That's where it's found out. It's found in the epiphysis. What is the function of red bone marrow? To produce what? What type of cells? Blood cells. What type of blood cells? All of them. Many students think because it's red, it only produces red blood cells. It produces white blood cells. It produces platelets and red blood cells. It'll produce them all, not just red. Okay, it is red because most of the blood cells are red blood cells, but it produces them all. On your cards, please. Which cell dissolves old bone for reconstruction? Remember, cuts, breaks down. Which one creates new bone? Which one's the builder? Osteoblast. Okay, so we need to be able to identify them by their function. Okay, just like this. All right. Many folks have this misconception that bone will either be made of compact bone or spongy bone, and that is not true. This femur is cut, and you can see where the bone is solid. Where the bone is solid, that is compact bone. You're going to see areas where the bone is porous. That means you can see gaps and spaces in between. All of this is spongy bone. They are both made, believe it or not, of bone tissue, but two different types of bone tissue. And as silly as it is, this is the region. Spongy bone. This is the tissue. Spongy bone, connective tissue. So on the practical exam, when you get mad at us for not marking you correct because you just wrote spongy or bone and didn't write bone connective tissue, this is why. They're talking about two different parts. All right. Compact bone is the region. What is the tissue? Compact bone connective tissue. On the practical exam, I believe we gave you simply skeletal, compact tissue, or bone, compact tissue. This is both. That's all. Okay, it is both. There's just two specific types. Just heads up. So we want you to use this, whatever it says on your practical guide handout, okay? I think it even says bone tissue will work. I think that's what your practical handout says. Just don't write bone. Bone is an organ. Depending on, and you can put ET and connective tissue like I did, CT, because that's what's on your handout. Okay. All right. Spongy bone, compact bone. Please ask your lab instructors to show you these. Because when we have a cross section of a skull, I think this is really cool. The top layer of the skull is compact bone. The outer layer, the inner layer, compact bone. And then everything in the innards is spongy bone. Those bone filaments. Oh, wrong tool. Let's try that again. These bone filaments, these are called trabeculae. They make a network. Oh, let me try that again. Ran out of space. They make a network. Trabecula is singular with an E at the end is plural. They make a network of bone with space in it. And what is really fascinating when you look at the biophysical model of these is when you look at how the tuberculae are arranged, they are arranged to withstand compression and tension. So the arrangement of the trabeculae is crucial in being able to support the mass of an individual. When you start looking at x-rays and certain imaging of your patient, you're going to be able to say, that person very prone to breaking a hip just because of how these trabeculae are aligned. They are designed to resist stress. Okay. Very, very fascinating. Only spongy bone have trabeculae, and they need that organization to support structure. Stress. All right. Here we are showing you, or I am showing you, again, the layers. What is the inner layer of this region? What is that region of that bone called? Compact bone. You can see the periosteum, that white stuff, and the endosteum, the inner stuff, the inner layers. If you pull back the periosteum, here's the periosteum, this outer white layer. Hiding underneath the periosteum, you are going to have all the cells that help the bone grow. You're going to have osteoblast. You're going to have osteoprogenitors. And very few, very, very few osteoclasts there, even on the outer. Okay, even on the outer. Osteoclasts like to be in the inner layer. There are more in there than the outer layer. Okay. So when we look at this layer here, you will see what's happening in this image. Which cells are these? They're on top of hyaline cartilage, folks. Osteoblast. Which cells are these? Osteoprogenitor. Those almost always are arranged next to progenitor, next to osteoblast. Look at all the nuclei. What is that one? Osteoclast. Okay. And what is fascinating is this one its activity will get ramped up. Will get ramped up when your blood calcium is low. So one of the things your doctors will check is your blood calcium low? If it's low, guess what these do? These break down bone. Why do they break down bone? To increase that free calcium that gets dissolved into your blood. If these do not pick up the slack, if these have low activity, and these have high activity, you're going to get weak bones, osteoporosis. What does that mean? You're going to have low, dense bones. These are very prone to breakage, especially late in age. Talk a lot about that in physio. Ossification is the process of making skeletal tissue. And like I mentioned, your skeleton starts, your bone starts as hyaline cartilage, and it will be transformed into bone tissue. So a lot of things have to happen. These cells have to get wiped out. Chondrocytes cannot live in bone tissue. The gel, the cartilage has to be replaced by bone salts. Replaced, I should say, by bone. So what event actually happens is one way to say it, and it makes sense, is you'll start to have one layer of bone, another layer of bone, another layer of bone, and eventually the bone invades the hyaline cartilage, takes over. Let me get to that, yes. Hyaline cartilage is not vascularized, is not innervated. What does that mean? That means the oxygen that runs through the blood vessels, because the matrix is like a gel, that oxygen can diffuse through the gel. So cartilage does not need blood vessels running through it. This is a gel-like substance. It has similar properties to water. Oxygen can diffuse right through it. Well, when this becomes skeletal tissue, blood vessels have to run through the bone. So the blood vessels also have to invade the hyaline cartilage when you're developing bone, when children are growing. That'll allow the oxygen to travel into this space. Okay. And here's the interesting thing. Osteocytes, here's an osteocyte in here, have these little tiny canals. They look like little legs sticking off of them. And that word literally that described them literally means tiny canals. It is canaliculi. That literally means tiny canals. Canaliculi. Why does the osteocyte need that? Because the oxygen will travel, diffuse through those legs. Then the oxygen will travel to the next cell, to the neighboring cells, through those little canals. They exchange nutrients with each other. They're kind of holding hands, allowing diffusion to occur through those tiny canals. Because the bone is so dense, oxygen cannot travel through the bone matrix. So this bone matrix is dense. It is made of a calcium phosphate salt. It's too dense. Well, you don't have to know the names of the inorganic salts. Just know that it's made of calcium and phosphate salts. One more thing. You don't see it. You don't see it in hyaline cartilage, but there are fibers in here. What are the fibers inside hyaline cartilage? You guys told me earlier. Collagen. Are they visible? No, but they are there. What about in bone? What fibers are found in there? Also collagen, but you don't see it. They are there. Oh, I meant to tell you that earlier, giving you all the answers right before I ask you of it. Is cartilage innervated? What are you going to tell me? No. Is it vascularized? No. Is bone innervated? Yes. It hurts when you break bones. Is it vascularized? Yes. Bones will bleed. Do bones contain collagen? Yes. Does cartilage contain collagen? Yes. They both contain so much collagen. I mentioned this before. When you drink your collagen powder, it is mainly ground up bone and ground up cartilage. That's what that powder is. Collagen. Endochondral ossification. When your bones start during development as an embryo, your bones are 100% hyaline cartilage. I don't even know if we can call them bones. I believe the technical term is skeletal element. No bone. They are 100% cartilage. Well, one of the first things that happens is the inner center starts to get eaten away. Your body starts to kill the cells in the center, and it starts to make a cavity in the center. So it starts to dissolve the cartilage inside to the point where it makes a cavity. Folks, this will become the medullary cavity. In addition, what is that? your blood vessels have to start to invade the cavity. Look at it. It's done so. Now it's inside. Once it's inside, guess what? The bone can start to form. It'll also start to form on the outside. So technically, the diaphysis forms first. I believe this is, I should have written this down, about 12 weeks in as an embryo. You're still an embryo at this point. Not embryo, fetus at this point. The diaphysis, it's almost all bone. The bone has invaded the diaphysis. The blood vessels have invaded the diaphysis. You're starting to form your bone now. At this point, your epiphysis, you can see they haven't formed yet. Is still cartilage. Eventually, the blood vessels move in. On both sides. As a result, the bone starts to form. The bone forms on the outer edges as well. Okay. And what is happening throughout growth, all right, is these, let me pick a better color. These, another better color, are the osteoblast. They are starting to make new bone and build their way up. And these chondrocytes right here, they're a different color. Why? They're dying. Your body will kill those chondrocytes to allow the bone to fill and take over that space. Okay. So slowly over time, the bone's just going to grow in that direction, that direction, that direction, that direction, that direction, that direction. Okay. So this is what the bone will look like at birth, or there's still a lot of cartilage because that baby still has a lot to grow. As an adult, and by adult, I mean like a late teenager, the cartilage is all just the end of the bone. You have your epiphyseal line. That's where the border was. That is this region right here. So you can see how the bone invaded and pretty much takes over. It needs to start as cartilage first, however. That is important. So think about it. Average child is about 20 inches in height. Average adult, 70 inches in height. Bones have to grow. Not only do they have to grow longer, they also have to grow wider to support the weight. Okay. So bone will grow in length and width. And I want you to think of it as the following. Growth in length. Okay. When you have a child, their epiphyseal line is full of cartilage, like there. When you see cartilage, that is not the epiphyseal line. That is called the epiphyseal growth plate. when you see cartilage. This is how when you take an x-ray, if you see cartilage there, it looks weird because there'll just be a big gap in between the bone. Because cartilage doesn't show up well in x-rays. You're going to be like, oh, this kid still has a lot more to grow. Okay. Here's what happens to grow in length. First, the cartilage will actually get a little bit thicker. So the cartilage has thickened a bit. Same here. It will thicken. And once it's thickened, the bone will fill in that space. So the bone grows in length just a little bit. Over time, this is how you're going to get longer, long bones. It just takes time. All right. So that's what's going to allow the bone to grow in length. Once that cartilage is absent here, it is now an epiphyseal line. And that person is done growing. No more cartilage there. Yes. Oh, yeah. Oh, yeah. Early injuries will make not only it not grow, can cause it not to grow, but it'll also cause it to grow incorrectly. And those happens during early childhood injuries. Got to keep those monitored. Okay. Growth in width. Oh, I'm sorry. This is interstitial growth in length. This is showing interstitial growth, growing in length. Growth in width is appositional growth. Why? Because you have to do apoptosis. That means you have to kill a lot of bone in order to grow wider. How does this work? When you are an infant, your bone is probably only like that big around. I'm sorry, that big around. Like an inch. Your humerus, your femur. They're not very wide. Okay, so what happens is when you grow into a kid, that bone has to get wider. And that's what's happening here. It widens a little bit. But you don't need the original bone. So this is killed. This is dissolved. This is lost. So now only this remains as a child. Well, you're going to grow again because from a child to an adult, we're going to put on more mass. We're going to put on more height. So that has to change. And again, you're going to kill this off as you grow in width. So growth in width usually involves killing the bone, killing the cells, apoptosis, hence the name appositional growth. And I want you to think of this as growing the bone wider. That's why growing pains. Okay. So here, this is the line that the bone used to be. That's where the bone used to be. All right. So if you think about it, this area where the bone once was when you were a child is lost for it to grow taller. So there's a change in width. Technically, this bone remodeling involves both appositional and interstitial growth. Okay, involves bone remodeling, involves both. But you do have areas where the bone is killed, is dissolved, so you can build new areas of bone, new areas of bone, so that you can grow to your adult stage. This is how I'm gonna ask it. Once you answer this question, 10-minute break. So let's come back at 9:10. When the femur grows wider, what type of growth are you going to call that? Oppositional growth. What about when it gets longer? Interstitial growth. Bone shapes. If you didn't notice, your reading guide for this one has a lot of chapters. It has 4, 6, 7, and 8. But 4, 6, 4, 7, and 8 are really short. 4 we already did. Like, what is cartilage tissue? What are the cells made up? How is it arranged? Which is innervated? Which is vascularized? We already did chapter 4. Chapter 7 and 8. We need to know some of the names of basic bones. What bone is this one? What is its name? No, the name of the bone. The actual name of the bone. Which one? Okay. Technically, yes. Pubis? It's not my favorite. That is your hip bone. Os coxa. Does anybody recognize the bone for B, the name of that one? Rib. Just as like that. That's simple. It's just a rib. This one, I don't expect you to know this one. This one is the talus. That is your ankle bone. This one, I absolutely expect you to know. The femur, the longest bone in your body. And I kind of gave it away. Tell me what the bone shapes are. Write them down on your card. I'll give you a minute or two. The bone shapes. The os coxa, I will tell you, is one of the weirdest bones in your body. Because technically, when you're a kid, it is 3 bones. And then when you become an adult, it's 1 bone. So weird. Okay. But this one that I'm pointing to, this is the body of that bone. So that means it grows these crazy extensions, which classifies that one as what type of bone? Irregular. It grows an extension. Just like the vertebrae goes parts out of it, which makes it irregular. The rib is a mean one. It is not a long bone. It is a flat bone. Okay? Because it does not grow in that direction. It grows in this direction. It grows very short, but more wide. So it is a flat bone. Talus is easy. Femur is easy. Okay. Sesamoid will include flat bones. That's why I don't like even including that. I'm only going to ask you to identify these 4. Okay. That's why I said, like, the patella is a good example of this. But yes, the rib will be both. So is the sternum. Bones break. It's not fun. Okay. You're going to see some really gnarly stuff in your later careers. Okay. There's all sorts of different types. There's some that are more fractures, some that are just complete separations, and they have to heal. So the first thing you have to do is set them. That means put them back in their original place as best as you can. Some of these require pins, screws to hold them in place. Not fun. Not fun. Some of them will only require casts, makes it easier because of how bones heal. Once they break, the bones have to be set. They have to be put back into the original place because of what happens first. You're going to get a pool of blood called the hematoma stage. So that's going to be filled with blood. That blood supply is going to transport the nutrients needed to fill in the break. Your body is going to use a building tissue like a glue, like a cement. The tissue is going to use with that blood supply, it's going to build this tissue in blue. That's going to fill in the gaps. It's going to hold everything together during the healing process. And this is a fibrocartilage mass. So first it was filled with blood. Then it's going to fill with fibrocartilage, not hyaline cartilage. Fibrocartilage has more collagen in it to really support the healing process. It's going to form a fibrocartilage mass. Then the bone cells are going to take over the fibrocartilage. So the bone starts to fill in. So now you have the bone fills in the fibrocartilage. The fibrocartilage is lost. It is invaded by the bone. That is a bone mass fills. And you can see the bone is bigger than it needs to be. That's what's like a bone mass. Lastly, it needs to reconstruct itself. Reconstruction is going to highly depend on the cells that break all of that excess bone down. So the osteoclasts are going to reconstruct the bone so that it is as back to its original shape as possible. Is it ever going to be 100% perfect? Never. Never. You're going to have, even though doctors did a great job of setting it in, you healed perfectly, you took care of yourself perfectly. A good doctor is going to be able to say, oh, it looks like you broke your bone about 10 years ago. You're going to be able to see it, visualize it, and understand about how long ago it healed. So first, hematoma. Second, fibrocartilage. Third, bone. Fourth, reconstruction done by the osteoclast. This is how I want you to think of the healing process when it comes to broken bones. Yes. When someone has a pin in there, yes. When they remove the pin, it has to do it again to replace the area the pin was in. Does that make sense? So sometimes they remove pins, or screws really, not pins. Sometimes screws are removed. Pins will, you're right, pins stay in place. They're permanent. Right. Yeah, so there's going to be people that have pins. They have plates, right? I've heard of people having plates permanently put into their bones to really help support it during this healing process, right? Because without it, there's no way to really keep it in place, right? Yep. Break the bone. Ugh, no, thank you. By this, oh, I want you to tell me stage 1, stage 2, stage 3, or stage 4. When does the blood pool start to form? That is what a hematoma is. This is a pool of blood. This is first. During the bone healing process, when does ossification begin? Well, stage 3 is when the bone mass is complete. So stage 2, you can see some bone forming in the fibrocartilage. Okay. So when the fibrocartilage mass is formed, there's already bone coming in. So it started. This is when the ossification takeover of fibrocartilage is complete. Okay. So this one is stage 2 when it begins. Bones of the body. We're going to start this in lab next week. The axial skeleton. The axial skeleton includes the skull, the thoracic cage, and the vertebral column. That is the axial skeleton. The appendicular skeleton, the shoulder bones, arm, forearm, hand bones, the hip bones, the thigh bone, leg bones, ankle bones, foot bones. How many bones in the human body as an adult? 206, and some people have more. What's that? In the skull. We don't have real time to go over that, but some people develop more in the skull. Correct. So they develop, instead of one bone, 2 bones. They're called sutural bones. So for the axial skeleton, like I said, it had the skull, the vertebral column, the thoracic cage. For the sake of this lecture, all I want you to be able to do is name the bone and tell me, is it part of the skull, vertebral column, or thoracic cage? We have to name 80 bones. Sounds like a lot, but believe it or not, it really isn't. The skull, there are 14 facial bones and 8 cranial bones. The facial bones do not come in contact with the brain. They make the face for the most part and the mouth. The cranial bones are the ones that make your cranial cavity, and they come in contact with the brain. Your frontal bone is your forehead bone. Hold on, let me remind myself what slide I have next. Okay, good. Good. Your cheekbones, you have 2 of them. Zygomatic. Your upper jaw, you have 2 of them. What is it? Maxilla. That's singular, that's plural. I don't care which you use, okay? So you're gonna see it, both. The bones that make the bridge of your nose. There's two of them. Does anybody know what name of that one is? Easy. Nasal bone. What's the lower jaw called? And tell me there's one of those. Mandible. Where it gets really, really, really messy, if you ask me, is inside your nose. Inside that nasal cavity. Here we go. The lower part. This bone is your vomer. It makes the lower septum, the lower half. The upper half, ethmoid, 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 ethmoid in yellow. And then you have this bone that kind of comes out of the blue. This one, oh, this, why did I change it to white? This one right here in white. That bone has a long name. Are we ready? It is the lowest inferior nasal concha. My favorite bone, hint, hint, is your tear duct bone. You have two of them. You can barely see it. It's this little one in green. It's a tear duct bone. Folks, what's the Spanish word for tears? Lágrima. Lacrimal. The lacrimal bone. Literally means tear duct bone. Those are the ones we can clearly see from the front of the skull. Side of the skull. Here we have frontal. Which one was the cheekbone? Zygomatic. That's just to help us orient from the front. You have two of these, a right and a left upper skull bone. Does anybody know what that one's called? Parietal. The side of the head that makes your hearing parts. What is that one? Temporal. The back of the head that also makes the base. Look, it goes down to here, all the way over here even. What is that bone? Occipital bone. The one that's really nasty is the one that's hanging out right here in pink. This is a central internal bone. This one is your sphenoid bone. Ah, look, you can see the lacrimal bone very well there. There's that one. I forgot you can see it better from this view. That's all the bones of the skull. It's a lot. 22 of them. Some of them are paired. That's why it doesn't seem like it's 22. For example, there's one parietal the right, two parietals the left. So there's the right and left parietal, right and left temporal, right and left maxilla. So they kind of double count. Look, almost said this wrong. The vertebral column, pretty much all vertebrae. This is where the head is. And it just goes down. So these are your neck bones. What do we call the neck bones? Cervical. Oh Lord. Is that right? Cervical? Yes. Can never remember if it's CAL or CLE with that one. You have 7 of these. The very first one, you're going to call it C1 for cervical vertebra number 1. The second one, C2, C3, C4 to C7. That's 7 more bones done. C1 through C7. The ones that make up your ribs, thoracic, makes your thoracic cage, which is the same thing as your rib cage. This one right here, T1, T2, T3, all the way down to T12. 12 more done. C1 through C7, T1 through T12. This set of bones is your lower back. There's 5 of them. Lower back. What are those called? Lumbar. L1, L2, L3, L4, L5. This one is part of your axioskeleton. This is where your hips attach. Your hips are part of your appendicular skeleton. This one bone, sacrum. The true tailbone. Some people will call the sacrum the tailbone, the true tailbone. Coccyx. Spelling on that one sucks. That's 26 bones. It's more than 10% of all the bones we need to name. Easy peasy. C1, C2, C3, T1, T2, T3, L1, L2. Well, you got to remember sacrum and coccyx. How many cervical vertebrae are there? 7. How many thoracic? How many lumbar? 5. What time do you eat breakfast? What time do you eat lunch? Noon. You're an old fart like me. What time do you eat dinner? Okay. In lab, we're going to have to be able to identify them. Okay. For now, just C1 through C7 at the neck. T1 through T12 in order from top to bottom. L1 through L5. You're going to hear people who have herniated discs. You have a disc that's herniated between L2 and L3. I need you to know what that means. What? Technically, kind of kind of the same thing. There's the disc in between the vertebra is made of fibrocartilage, and for some reason it is bruised around it, so it's bulging out. It's misplaced. Why does it hurt? We're gonna learn. Nerves come out of there, and it'll pinch the nerves when it's bulging, and it can hurt. It can be debilitating. Sacrum and coccyx. Don't call this a tailbone. Sacrum, the true tailbone, the little one. This is actually what used to be four vertebrae that are fused as one. This one you can see there's 1, 2, 3, 4, 5 vertebrae that are fused as one. You're gonna get this. You're gonna get patients who have very long coccyx because suddenly they have more. They'll have 5, 6, 7, 8. And this is dubbed a tail. I don't know if that's the best way to call it, but it does need surgery early on because it will disrupt how the person can sit. Thoracic cage. The chest plate. What's the chest plate called? And that's all I need you to know. For lecture, not lab. It's a different story. It has 3 regions. And we'll learn it. Technically, this is part of the sternum too. How many ribs do we have? We have 12 pairs. 2 vertebrae for every thoracic. 2 ribs for every thoracic vertebrae. So the ribs are all attached to the thoracic vertebra. We have rib 1. Rib 1. Right rib 1, left rib 1. So I'm gonna go rib 2, rib 3, all the way down. Telling you this is rib 12. Floating rib, rib 11. Floating rib, they're not attached to the sternum. That's 25 more bones right there. Rib 1, rib 2, rib 3, rib 4, rib 5, rib 6, rib 7, rib 8, rib 9, 10, 11, 12. Right and left. That's 24 ribs. And the sternum. That makes the thoracic cage. The ribs are all attached to thoracic vertebra. You can see there's one rib attached to the right side here. There will be another rib attached to the left side. And remember, they go all the way around. So they'll touch the rib, they go all the way around, and they will come and ribs 1 through 10 attached to the sternum. Ribs 11, ribs 12 do not. They are floating. This is how I'll ask questions about the bones that we just talked about. If I ask facial bones, these do not come in contact with the brain. These are the skull bones that do not come in contact with the brain. Let's hear at least 2. Someone shout one out. Mandible. I heard that one. What's another one? Maxilla. What's another one? Lacrimal. Zygomatic. Nasal. Brain farting. Nasal. Vomer. Somebody said it. Thank you. I have to think about that one. Cranial bones. They come in contact with the brain. Name them. Occipital. Temporal. Frontal. Sphenoid. Ethmoid. Parietal. Which vertebrae are attached to ribs thoracic. And it is important that T1 through T12 all are attached to ribs. They're attached to the right side and left side of their appropriate number. Bones of the appendicular division. The ones that make the shoulders, the pelvic girdle. I said pelvic girdle, didn't I? The pectoral girdle. Let's try that again. And the pelvic girdle. Don't forget, those people want to call those part of the axial division. So the shoulder bones and the hip bones are a part of the appendicular division. And the rest of them shown in pink there. The pectoral girdle, there's only two bones. This bone, which is often called the collarbone, you will not call it a collarbone in my class. What is that called? The clavicle. This bone is often called the shoulder blade. It's in the back. What is that one called? The scapula. There are two of them, one on the right side, one on the left side. They make up the pectoral girdle. They are the shoulder, the bones of the shoulder socket. Bones in the upper limb, bones in the arm. There's only one. What is it? So funny. The humerus. There's only one bone there. Bones of the lower limb. There are two. Radius and ulna. When you're in anatomical position, the ulna, is it medial or lateral? Medial. This is on your pinky side. I say pinkies up for ulna. When you're fancy and you're drinking your tea and you hold your pinkies up, it's on this side, on the pinky side. The radius is on the lateral side. I say the radius is rad. When it's rad, you give a thumbs up. It's on this side. Radius, ulna. You have two bones in your forearm. Okay. I'm going to stop right here and tell you, it always blows my mind how people forget that these things are conserved invertebrates. Why do I mention that? When you eat chicken wings, there's the drumlet, has one bone in it. That's the humerus. When you eat the flats on the chicken wings, there's two bones in it. That's the radius and ulna. It's conserved. Now we're all gonna go ask for chicken wings later. This hand is the right hand, and it is an anterior view. We have to recall anatomical position. What that means is you're looking at it like you're gonna give yourself a face palm, because the palms is the anterior side. So Like you're holding up your right hand, you're gonna give yourself a face palm. That is that hand. Okay. The wrist bones. For the sake of this class, thank God. Just carpal bones. You don't have to know. Scaphoid, lunate. I don't remember the rest of them. Your palm bones for the sake of lecture. Metacarpals. You don't even have to know the numbers for lecture. You will have to know them for lab. No. For the sake of this lecture, for lecture, the fingers, every single one of them. Each one of them is called what? The singular versus plural. Let's see if I can spell it right. Phalanx is singular. What's plural? Phalanges. Latin sucks. Right there. Carpals, metacarpals, and the phalanges. If I can do math fast enough. 14. Can't do math. It's too late. 13 plus 14. That's 27 bones in each hand. 27 bones. There's 8 carpals, 5 metacarpals, and 14 phalanges. That adds up to 27, right? Somebody help me out. Yes, 27. So each hand has more than 10% of all the bones in your body. The pelvic girdle. Each one of these is an os coxa. Technically, for lecture, we'll accept hip bone, but os coxa is the appropriate term. And like I mentioned earlier, your os coxa when you're a child is 3 different bones. That's why we need you to know this. Some of your patients are going to be children. The one in yellow, ilium. The one in red, pubis. That's in your pubic region. The one in green. This is the one you're all sitting on. Ischium. When you're an adult, they will fuse and be the os coxa. Sometimes doctors will still refer to that top part as the ilium, even when it's completely fused. Hence why we have to learn them. The thigh, the femoral region technically has 2 bones. The big one being the femur. What's this one? Your kneecaps. The patella and the femur. The patella is really in your knee region, but it's usually coupled with the femur. Your leg region has 2 bones. Which one's the big one? Tibia. Which one's the thin little one? Fibula. Here's what I don't want to see. Tibula. It's not a bone. Okay. The tibia is always medial. The fibula will always be lateral. That means the fibula is always pointing on the outer lateral side. Always be that way. Fibula, tibia. Bones of the foot and ankle. Why am I brain farting? You have your ankle bones. There are 7 of them. These are your tarsals. These are often referred to as the ankle bones, but that's a bad term because it also includes your heel bone, the real ankle bone. We'll go over that in lab. The foot bones, metatarsals. And what are the toesies called? They're not called toesies. Don't call them toesies. You can tell anatomists got lazy when they were naming these. Do you know why it's really bad? Because someone is going to put a stint on the right distal phalanx 1 on the toe when they meant this one. Happens all the time because they're named the same thing. Someone forgot to put on the hand or the foot, and your patient gets a stint on the wrong blood vessel. The whole thing is called the hallux. And this is called, the whole thing is called the pollex. It happens. That's all the bones in the body. Some of them just have numbers associated with them, like T1, T2, T3, T4, etc. Once you complete your cards,